Hi, hello, good morning, and welcome you all to the 90th episode of Business Bytes with Bhavana. So, today we are going to talk about something that is needed to all of us. What is it? A beautiful smile, and hence the beautiful teeth, right? So, we're going to interact with one of our dental doctors from Vishakhapatnam. So, let us all together welcome Dr. Dr. L. Chandrasekhar, MDS, Lakshmi Dental Care, Laser and Implant Specialist from Vishakhapatnam. Hello, Chandrasekhar garu, ela unnaru?
Hello, ma'am. Very good morning to you.
Very good morning. How are you doing today?
Yeah, great, ma'am. Doing and happy to see you.
Wonderful. Same here, sir. Nice to have you.
Yeah,
So, Dr. L. Chandrasekhar Garu, he's done the Masters in Dental Surgery. He's a gum specialist, president for Indian Dental Association, Central Council member for National IDA, quality manager for NABH, that is National Accreditation Board for Healthcare, part of various service organizations and has taken up leadership roles also. And he's done a fellowship course on implants from Europe. So he's proved that there is no ending for learning. It's always ongoing, Ani. Wonderful, Chandrasekhar Garu. Nice to have you here today. So good morning to all the audience also who's joined in live. Uh, so if you have any questions related to dentistry, right? How to keep my teeth clean, how to have a beautiful smile, what are the latest technologies in dental industry, like dental doctor industry, dental treatments, any questions that you have, or I often get toothache, I do so and so and it gets fine. So is that okay, or should I consult a doctor? So a lot of questions that we might be having, right? So do not hesitate to post those in the comment section, and our doctor will be more than happy to take up your questions and help you with the right solutions that you could actually get. Right. All right. So, Chandrasekhar Garu,
yeah, ma'am.
nice to have you in our WeVysya family because doctor is a very noble profession, whatever doctor it is.
Thank you. Thank you
So,
so
it was
much.
our pleasure to have you. And so, how did you get into this stream, sir? Like,
Yeah.
dental.
Okay. Before I start this thing, I'll say that you have a perfect smile, ma'am.
Thank you.
See, we
Thank you so
always
much.
says that a smile is not a straight line; it's a curve. That you
Yeah.
got it. Yeah, you have all rights to be a host for the
Wow.
to host a dentist.
Thank you. Thank
That's
you
what.
so much.
That's wonderful. Yeah, and
Yeah.
yeah, basically after my plus two, I have done BPC. I
Okay.
couldn't crack down into MSET. So we used to have an MSET and quite tough competition we used to have. And during that time, there are no private colleges. There are only
Mhm.
government colleges, either medical dentistry or anywhere in veterinary sciences. So I
Mhm.
was searching for which profession after BPC you have to take it. So I
Mhm.
consulted my parents and they said like, see, we can give only a government seat. You can try for a government, but not a payment seat. And it was a quite tough competition. I couldn't cope up to that level. And
Okay.
fortunately or unfortunately, like my father found there is a dentistry kind of a profession in the society where you can pursue
Mhm.
it. So the
Okay.
vision is with my father. Frankly speaking, it is not my vision. My father has a
Mhm.
vision that I can do something in medical profession. So
Okay.
he has opted dentistry. Then he has transferred that knowledge to me, saying that yes, you can hold this profession. So that's how I have entered into the dental profession after my plus two. So I'm like I never been to a dentist. I mean, sorry to say that. Till my plus two, I never been to a dentist, and
Okay. Okay.
somehow I could take up this profession after my plus two.
Mhm.
So that credit goes to my father, frankly speaking. So I give the whole credit, my success to my father only, because
Okay. That's
I
awesome.
know only two professions in medical. One is an MBBS, and another one is I'm an animal lover, so veterinary sciences.
Okay. Okay.
So I know those two professions. Other than that, so that's how
Okay.
I have entered into the medical profession, especially dental profession. And
Okay.
I've done my undergraduation. We call it as a bachelor's of dental surgery from
Okay.
Ramchandra Medical College, Chennai.
Chennai.
That's
Okay.
Chennai.
Uh-huh.
That's one of the prestigious medical college. It's
Mm-hmm,
like
mm-hmm.
top 10 medical colleges in India.
Okay.
So they,
Okay.
mine was in first batch of that
Oh.
medical college.
Mm-hmm.
So I
So
have
you
done
can
my
probably say like, I have been one of the first students of that college.
we don't have any seniors.
Okay.
There's no ragging, but ragging is there from other branches. MBBS people they used to rag us.
Okay. Okay.
Mm.
All
So
right.
it was a 5 years course.
Uh-huh.
So I have done my undergraduation there. Then I worked as lec- lecturer in the sorry lecturer in the same college for 1 year.
Okay. Mm-hmm.
Then I shifted to the masters to Gulbarga. That's in Karnataka.
Yes. Yeah.
Yeah, so there I have done my masters for
Okay.
3 years. So that's my journey, especially
Okay.
my UG and PG.
That's really nice to hear, Chandrasekhar Garu. So we have our audience who's joined in live. So very good morning to all of you. Raghuram Garu from Bangalore, good morning antunaru. Dinesh Yalamarthi, good morning antunaru. Gupta Sanidhi Garu, good morning antunaru. Sai Swarup, good morning antunaru. Geeta Babu, good morning antunaru. Durga Shanti Garu Naru, good morning Dr. Garu and Bhavana ji antunaru. Very good morning, Andy. Um, Dr. G is my family dentist. We are very happy with his services అని చెప్తున్నారు శ్రీరామ్ గుప్తా గారు.
Great, great,
Yeah.
great to know that.
Uh, థ్యాంక్స్ శ్రీరామ్ గుప్తా గారు. అనిల్ గుప్తా గారు గుడ్ మార్నింగ్ బోత్ అని చెప్తున్నారు.
Well said.
సంతోష్ కుమార్ గారు గుడ్ మార్నింగ్ డాక్టర్ గారు అండ్ భావన గారు అంటున్నారు. వెరీ గుడ్ మార్నింగ్ అండి. కౌశిక్ హరీష్ శెట్టి గుడ్ మార్నింగ్ భావన గారు అండ్ డాక్టర్ గారు అంటున్నారు. వెరీ గుడ్ మార్నింగ్. కుమార్ గారు ఉన్నారు. గుడ్ మార్నింగ్ భావన మేడం అండ్ డాక్టర్ సార్ అని చెప్తున్నారు.
Uh,
గుప్తా సన్నిధి గారు ఎవర్ స్మైల్ శేఖర్ గారు నాట్ ఓన్లీ గుడ్ ఇన్ ప్రొఫెషన్ హ్యావింగ్ గుడ్ మేనేజ్మెంట్ స్కిల్స్ హీ సర్వ్డ్ యాజ్ జనరల్ సెక్రటరీ ఫర్ 3 బిగ్ ఆర్గనైజేషన్స్ వాస్వి క్లబ్ రోటరీ క్లబ్ అని చెప్తున్నారు. Yeah, very
thank you,
nice.
sir.
And
Thank you
as we
so
said,
much.
yeah, he's led service organizations.
Okay.
Nice to know that. Best doctor for dentist issues అని చెప్తున్నారు. Dental issues అని సంతోష్ కుమార్
Thank you,
గారు.
Santosh. Thank you so much.
దుర్గా శాంతి గారు నా మేనకోడలికి ట్రీట్మెంట్ చంద్రశేఖర్ గారు వెరీ నైస్ అండ్ గుడ్ ట్రీట్మెంట్ అని
Thank you, man.
చెప్తున్నారు.
Thank you, Durga, ma'am. Thank you so much.
సాయి స్వరూప్ గారు మేడం యువర్ తెలుగు ఇస్ గుడ్ అంటున్నారు. థ్యాంక్ యూ అండి. ఆల్ రైట్. కుమార్ గారు డాక్టర్ గారు ఇస్ వెరీ యాక్టివ్ మెంబర్ అండ్ నైస్ స్పీకర్ ఇన్ అగస్త్య హౌస్ అని చెప్తున్నారు.
Wonderful to see all these
లవ్లీ కమెంట్స్.
testimonials.
ఎస్. హిస్ స్మైల్ ఇస్ హిస్ పబ్లిసిటీ అంటున్నారు సంతోష్ గారు. Of course, for a dental doctor, that is what is important also. Kada Chandrasekhar garu. Wonderful. You have to carry that beautiful smile. Very nice, Andy. Thanks to all the audience who's joining in live and stay during the session. And yes, as I said, if you have any questions related to dental problems or how to maintain dental hygiene, we're going to talk about all of it today. So stay tuned and definitely this will be one of the beneficial sessions I would feel, beneficial episodes I would feel. Right? All right. So Chandrasekhar Garu.
Yeah,
So, how many years is it that you have started this your own practice?
yeah. I
Is
have
it in
started in 2005, ma'am. Uh,
2005? Okay.
yeah. So Lakshmi Dental Care, it's my mom. Lakshmi is my mom's name.
Acha. Okay.
So
Mhm.
being an third son to her, I'm little
Okay.
close. So
Okay.
I always used to have like something should be there on my mom's name. So that's
Wonderful.
how I started my profession. See, my profession was given my father, and my
Yeah.
profession sustainability is given my mother. So
Wonderful. So, you
my
dedicated to your
parents,
parents. Very
yeah,
nice. You'll
totally.
always be blessed.
Yeah, my dedication goes to them. See, I'm standing here and I'm speaking with you and being in the WeVysya. Its credit goes to both of them, frankly speaking, mom and dad. So I started in
Wonderful.
2005.
Mm-hmm.
I have completed my master's and I had an internship, like kind of how to be, how to behave in a dental practice, and how to,
Okay.
because we are not learnt all those things. Only theory
Mm.
part they teach us. So in a clinic,
Okay.
it's not that. So I worked under one senior most dentist in Vizag for three
Mm-hmm.
months, learned
Mm-hmm.
the skills like behavioral management with the patients and all that stuff. Then I
Okay.
started my practice in Ramnagar.
Okay.
That's near Voltaire Club. We say that
Mm.
where that's one of the prime locality in Visakhapatnam. Okay,
Mm-hmm.
so there I have started in 2005.
Mm-hmm.
Then after 1 year of practice, I got married.
Mm-hmm.
Uh, then got married to a dentist only. She's
Oh,
Dr.
goodness.
Swapna. She's Dr.
Okay.
And she has
Wonderful.
pursued her bachelor's degree from Bangalore University, Rajiv Gandhi University, we call it, the Bangalore
Okay.
University, Ambedkar Dental
Mm-hmm.
College. And
Mm-hmm.
then we set up one more clinic for her. So we never tried to be in the same clinic, myself and my wife. I don't want to be
Okay.
like that, frankly speaking. So I asked her, like, anyhow, I want you to give an independent role. So I
Okay.
told her, like, so you start up a new practice, not with me.
Okay.
And she felt
Okay.
good for that, and she started a practice in Kancharpalam in 2006.
Okay. Where is it? Kancharpalam.
It's near I mean before Gajuwaka. I mean
Okay.
NAD junction is there.
Okay. It's in
That's
Vishakhapatnam only, is
it's in
it?
Visakhapatnam only.
Okay. Okay.
And
Yeah.
at
Hmm.
the same time, I used to go as a visiting dentist to small villages, one village called Yelamanchili.
Okay.
There I used to
Okay.
be in a week. In a week, I used to go for 2 days,
Mm-hmm. Mm-hmm.
practice there for 2 days, and I used to come down to Vizag.
Okay.
That
Okay.
was the in between journey. That in between, like 2006 to 2010. Then
Mm-hmm.
finally, we had come up with the two clinics. One is which I started in Ramnagar,
Mm-hmm.
near Chagadamba Junction, we call it as, and another
Okay.
one is in my house. That's
Okay.
MVP Colony.
Oh, okay. Mm-hmm.
So MVP Colony clinic seen by my wife.
Okay. Uh-huh.
Both clinics are same Lakshmi Dental Care only.
Okay. Wonderful. Wonderful,
So
Andy.
2005 to 2022, something around
Yeah.
16, more than
17,
16
16,
years of
17
experience.
years. Yeah. Yeah. Right. So amazing journey you might have had, right? Lots of learnings, lots of patience, different type of people that you've
Yeah,
got to talk with, different kind of challenging cases, lot more.
yeah.
Yes. Okay. Swarup Garu, he's saying he is the best person అని చెప్తున్నారు.
Oh, thank you so much, Swarup.
Gupta Sannidhi Garu, Dr. Swapna Garu, wife of Dr. Shekhar Garu, specialist in one sitting root canal treatment. Clinic is well equipped with latest equipment అని చెప్తున్నారు.
Nice to hear that. Thank you, Gupta Garu.
Yeah. Mana Suvarna Garu is online. He's saying, very good morning, Bhavana ma'am, Dr. Chandu Anna. Your big smile is your asset. Dr. Madam and little Dolly is his world. All the best, Anna. You're also inspiration to many, balancing your profession and heading many organizations. A future leader for our WeVysya అని అంటున్నారు.
Oh. I'm honored. Thank you, Savarna.
Wonderful. Nice to hear all the good compliments and all the good notes. Yes. So as we move on, what is the kind of scope of dentistry in today's world? Like if for the upcoming youngsters, or maybe for the benefit of our audience, what is the scope of dentistry? If you could talk about that.
Yeah. So now we are in like a traditional dentistry to the digital dentistry. We have entered to that level.
Mm-hmm.
Scope of dentistry means I say that enormous. I mean, see, sky is the limit for that. Because depends on your area, upon your skills. Scope of
Mm-hmm.
dentistry we can't measure at present, but you have a
Mm-hmm.
lot of opportunities in dentistry and dental field.
Mm-hmm.
um, so a person who doesn't want to see the emergencies in their life, they can pursue the dentistry. And the
Okay.
person who wants to be in a restricted time slot, they can be in a dentistry. And a person who
Okay.
wants to be ever smiling, they can be in a dentistry.
All right, wonderful. Hmm. That's the nice way to put across, actually. So
Yeah,
it's nothing like, dentistry is not for someone, or it is not like, there are too many doctors, and what will I do doing the dentistry?
yeah,
We need experts and specialists in every industry, right?
yeah,
If you are a topper and if you have these qualities, what a doctor is saying, or probably if you are not sure, you're interested, but you're not sure, like, should I really go there? And I don't know if I will succeed. So the topper is a topper wherever they go, right?
yeah,
So don't worry. I mean, definitely everybody could opt it, but I'm saying, like, there should be uh, some are really blessed, right, to
yeah,
excel in whatever they do. So might be that kind of people are needed in every industry also. So if anybody is really confused, like, should I really take it or not, definitely you could have a word with our Chandrasekhar Garu. He will
uh,
guide you, assist you on taking the right decisions. Like, maybe after a few years, you will thank him for his advice. I don't know, but if anybody is really interested and want to explore more, you could definitely get in touch with him. So his contact details is in the scrolling window. You could reach out to him at 9848382244. Very nice number, very easy number. 9848382244 is his contact details. Even if, like, any of your family members want to just get into this stream of education, right? So you could definitely connect with him. And to all the audience out there, like, we might have day to day a lot of issues related to our teeth, right? May it be related to the presentation, may it be related to internal issues, a lot of things, I don't know. So if any of such kinds, and you want to ask questions related to that, you could definitely get in touch with Chandrasekhar Garu for that as well. Might be they're serving in Vishakhapatnam as of now. And if I know it's not possible, like, everybody travel to Vishakhapatnam for treatment, but you could have a first round of kind of interaction with him, like, to know what you're going through, or what is the regular issues that you're going through, if there is any quick solution, home remedies, or something that you could do by yourself to overcome at that point of time, and later probably see a dentist in your region, and even give more right inputs to your dentist in your region. So all of those are there. So, but never hesitate to get in touch with our doctor, and to explore to understand more about the teeth, right? Okay,
ma'am.
so Sriram Guptagar is there. He's saying he's a super doctor with lot of talents and చెప్తున్నారు.
There was a study saying that 1 is to 5,000 in the society. A dentist is there for 5,000. That is very
Okay,
less.
okay,
So, in the
okay. So
scope of
there is only
dentistry,
one dentist for 5,000 people, and
5,000 people. Yeah,
yeah. So yeah, so there's a lot of scope there also for all of the upcoming students.
yeah.
Okay, Ramakrishna Vijjapu garu. Good morning, Bhavna garu and Dr. Chandrasekhar garu అని చెప్తున్నారు. Very good morning, Andy. All right. So, yes, so the thing is, like, there is a lot of scope to the youngsters also. Please do consider this the
As a
category of
profession. Yeah,
studies also, and you will definitely flourish with being an excellent professional in dentistry as well. Right. So, okay. Uh, in today's world, if you have to make the general public aware of, the dental hygiene, so what would you suggest?
okay,
How important is the dental hygiene in the day-to-day life?
okay. Yeah, before that, one thing I'll say that everyone neglects the dental hygiene first thing,
Mm.
because
Yes.
they think that we have a substitute. The only organ in the body which has a substitute is
Yes.
teeth.
Yeah.
If one tooth is missed and some other one is going to take care, so that's totally wrong. We say that
Hmm.
28 or 32. So 28 is a normal and 32 is wisdom tooth. So
Correct.
32, every tooth has its function. So we don't accept if any tooth gets missed. So we
Yeah.
say that every tooth has its function. And coming to the oral hygiene, how important, why I say that, there are a lot of studies saying that because of the dental infections, there is a chance of cardiac arrest, there is
Oh.
a chance of paralysis stroke,
Mm-hmm.
There is, especially for the women, there is a chance of preterm low birth weight, means early deliveries, preterm
Okay.
delivery, they say that. For the ladies,
Mhm.
there is a chance for the lung infections, lower respiratory tract infections. Now I can put it as a person who is having a poor oral hygiene is more prone for the COVID-19.
Okay. So it
So
is linked here as well.
yeah, we don't speak teeth, but we speak as a whole. This is the entry point for any disease. Dental
Right.
disease is an entry point for any systemic disease. There is a study saying that even dental infections increase the area of cancer.
Oh, okay.
So, on that perspective, I say that everyone should understand the importance of a teeth or importance of a dental hygiene. Think
Mm-hmm.
in a long run, because most of the dental diseases are chronic in nature. It is not given a symptom immediately. See, fever, you understand.
Yes.
Cardiac pain, you understand. Delivery pain, you understand. But a
Yes.
dental pain, you don't understand initially. It
Yes.
requires some journey that we call
Correct.
it as a chronic stage.
Okay.
Uh, so, at early detection of a dental problems will prevent you all these kind of side effects.
Mm-hmm. Mm-hmm.
That's the one thing. And keeping giving an oral hygiene, there are studies saying that if you want to increase your business scope, 30% says that your smile gives your growth in the business.
Yeah.
So
So
if
that is the
anyone
best medicine. It costs nothing, right?
if anyone wants to increase their business by the way of a smile, I say that smile plays a vital role in your
Yes.
business, frankly speaking.
Absolutely. Yeah.
For that, you require a teeth. So without teeth, you can't smile. Just
Yes.
imagine yourself without a teeth. Then you'll understand the scope of your.
Nobody will want to do that. Imagine also.
um,
Yes.
yeah, that's one thing. And we say that go for a regular dental visits in
Mm-hmm.
whichever place. We say we given time period like 6 months. Every 6 months means in a
Okay.
year go for a two dental
Okay.
visits.
Mm-hmm.
Brush your teeth with toothpaste and a toothbrush only. Don't use neem sticks kind of thing. They are very harsh in nature. Don't use
Mm-hmm.
tooth powders. Always use a simple toothpaste, something like a plain. Don't go for the gel forms. Go for a
Okay.
simple toothpaste, like a plain Colgate. Amino Shakti, they say that in the advertisement. That's a simple paste. Sometimes Pepsodent gum care. Who has just some gum problem, they can go for the Pepsodent gum care. So
Mm-hmm.
prefer less gel forms, more of an plain toothpaste. One thing.
Okay.
Brush your teeth at least twice. One is in the morning and another one before bed. For 30 seconds will do. We don't ask
Okay.
for 3 minutes or 5 minutes. 30
Mm-hmm.
seconds of a proper brushing will help you longevity of your teeth.
Okay. Okay. Mm-hmm.
So regular visits, 30%, I mean, use brushes and toothpaste. Now we are advising power toothbrushes, battery operated toothbrushes. So you can go
Okay.
for it. Powered toothbrushes.
What is the benefit of it
Yeah,
above?
generally there is an principle how to brush.
Mm-hmm.
So it's very difficult to show that. So what we say that is everything, the principle of a brushing technique is given in the toothbrush, power
Okay.
toothbrush. Yeah,
Okay.
circular motion and elliptical motion. So when you ask
Okay.
someone to move, do like this,
Yes.
it's very tough.
Uh-huh.
So
Uh-huh.
all these things done by the brush. We don't require
Okay.
to do
Okay.
physically.
Okay.
So
For
that's
that will ensure correct
yeah,
movement and reaches all parts of your
tough.
teeth.
Teeth.
Namata.
Yeah, that's one. And then eat less of and sticky foods like
Okay.
chocolates. If you're going to eat chocolates and brush your teeth. If you're going to eat
Okay.
five times you brush your teeth.
Okay. Okay. Mm-hmm.
More carbohydrate, less sticky foods.
Hmm. Hmm. Hmm.
Will gives a good oral hygiene.
Hmm. 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 Hmm.
So that's some of the points.
Okay. All right, that's very good tips for all of us to maintain good oral hygiene. I think we know we'll have to brush our teeth twice a day, but I don't know how many of us really do it in practice because it's all like what we've studied, right? So let us, if in case we are not doing it, let us all take this as an opportunity today and ensure at least from today we start doing it. And also we all have kids at home, right? Like as he said, chocolates are kids favorite. We cannot stay away from that. So
Yeah.
definitely see to it that whenever they're having chocolates, at least they brush their teeth after that, so that even their wish is fulfilled and our concerns are also taken care of. Yes. So,
Exactly.
Ramakrishna garu antunnaru, he supported a lot in COVID pandemic situation to all the Vasavians అని చెప్తున్నారు.
Thank you, Ram Krishna Gar. Thank you so much.
Suraj is there. Good morning, Dr. Garu and Bhavna ma'am అంటున్నారు. Very good morning,
Hi,
Suraj.
hi, Suraj.
Sainath Gupta garu. Hi, good morning, Bhavna garu and Dr. Chandrasekhar garu అంటున్నారు. Dr. Garu very friendly and very supportive person అని చెప్తున్నారు. Okay, then Srinivas Rao Garunaru, he's saying, good morning, really a legend. The first medical doctor of Agastya has given presentations also, huge knowledge and very humble. Helped so many members, a very good humor individually also. Ani చెప్తున్నారు.
Thank you so much, Srinivas Garu.
Dr. G, lots of information from this session అని చెప్తున్నారు శ్రీరామ్ గుప్తా గారు.
Thank you, thank you.
Okay, okay. I don't know. One of the Facebook users, okay, is asking like neem sticks are not harsh at all. Even simple toothpaste have harsh chemicals kada అని అడుగుతున్నారు.
Uh, might be. I mean, like, see, we see, generally we support the statements of a journal's presentation. We have a
Mhm.
studies. We have a studies on the toothbrush as well as the comparative to the neem stick, something like that. So initially, the acid that is produced from the neem stick sometimes it abrades the tooth tissue. So
Okay.
might be the version might change. So
Yeah.
I'll update with that. Frankly
Um,
speaking, if
yeah.
something, then I'll take back my statement.
Yes, so I mean, because it is from a Facebook group, I don't know who has commented, but anyways, I think, sir or madam, it is depending on a study that he's,
Yeah,
talking about it. But yeah, if there is a better study and it proves that it is better, definitely, Dr. Garu is ready to kind of,
yeah,
accept it. But it is a general notion based on the medical study. I
yeah,
also agree. Even I was thinking in my mind, like, they say neem sticks are good kada, enduku, why shouldn't we use any? But yeah, as you said, there might be studies made, like, at that time of, like in the past, when people used to live, their way of food habits was also different. Might be
yeah,
at that time it was good. And for today's generation, today's people, like what the food we consume and the kind of maintenance we do, might be it has changed and evolved, right?
yeah,
So it might differ. So
yeah,
it is like that. Nothing that it is good or bad. Yeah, might be for today's generation it might not serve the purpose of fully keeping the teeth healthy, is what when we mean when you say, right?
yeah,
That is that is how I understand it.
yeah. Research always changes, ma'am. Research always
Yeah.
changes. There are a lot of things.
Okay. So Sainath Gupta గారు అంటున్నారు, సార్ ప్లీజ్ గివ్ అ గుడ్ టిప్ టు కిడ్స్ టు మెయింటైన్ దేర్ టీత్ హెల్తీ అండ్ క్లీన్ అని చెప్తున్నారు.
Yeah. So one thing is that so before making our kids to understand the importance of teeth, get them to a dentist first. So
Mhm.
adjust to the kind of nature what is there in a dentist because most of the kids they are scared of seeing any hospital. They don't
Yes.
turn up to a hospital. If you say that it's a hospital, they are very scary. It's like a
Right.
scary picture for them, scary movie kind of thing. So what I say, a friendly visit to a dentist will always a good advice for the children first thing. Don't show the teeth also. Introduce your dentist as a friend to your kid saying
Right.
that. So that's the first thing which I say that. And slowly when the kids gets adjusted to the environment that is provided in the dentistry in a dental clinic, then slowly they adjust to the dental procedures and they'll volunteer for the dental treatment. I have seen many kids, frankly speaking, in my practice of 16, 17 years, they bring
Mhm.
their father to the dental clinic. Father is very scared of dental treatments. Kid says, Papa, nothing will happen. You come inside. I'll sit happily on the dental chair. So, Sainadhikar, you can start the kids' dental visit I can say that, see, 6 months is a time period. The first tooth erupts in the oral cavity. We call it as a deciduous tooth. But we say it as from the point of 6 years, you can start a
Mhm.
dental visits for the kids. And from there, you can establish 3
Okay. So
years
I
and a
think
4.
whatever you're saying makes sense not only for dental but in general also. It's good to introduce the kids to our doctors and just make them friendly so that whenever I wish the time doesn't come, but whenever there is a need, but we could easily tackle the situation
Yeah.
maybe.
Uh,
Yes, so there are more audience who's joining in live. Thanks for those tips. I think for all the audience out there, it's all our responsibility to ensure, like we are educating and taking care of
yeah.
our kids in the right way for all
Right.
the longer run. Yeah. Okay, Chandu Shri Garu. Good morning, Vivasya, Valmika, and Agastya House members, and Dr. Garu and Bhavna Garu untunaru. Very good morning, Andy.
Very good
Funny
morning.
Kumar. Good morning, Bhavna Garu and Dr. Chandra Sekhar Garu untunaru. Very good morning, Andy. Neeraja Garu wishing good morning to both of us. Ravi Shankar, good morning, Dr. Garu antunaru. Gaureshwar Rao Garu. Good morning, Bhavna Madam and Dr. Chandrasekhar Garu antunaru. Very good morning, Andy. Srinivas Garu. This time we will plan a visit to dentist for kids exclusively. Please
Oh,
indicate time and day, sir antunaru.
that's a wonderful initiative, Srinivas Garu.
Definitely
Beautiful.
wonderful, Srinivas Garu. If you could just fix up an appointment and go see them. So while we're talking about kids, Chandrasekhar Garu, so do you think for kids filling of teeth and all of that kind of thing is okay, or you say that
It's
we should avoid it for any reasons, like it
no, no.
might not grow well and things like that?
Okay, okay. See, deciduous tooth sheds naturally.
Mm-hmm.
That leads to a pathway for the permanent teeth.
Correct.
If you're not going to maintain your deciduous teeth, so always there can be a lot of problems.
Okay.
Initially, for the kids, there are pit and fissure cavities. The small cavities generally they have because deciduous teeth are the soft teeth. Permanent
Mm-hmm.
teeth are the little harder teeth. So
Right.
the soft teeth always has a nature to
Mm-hmm.
get decayed compared to the permanent teeth.
Okay. Okay.
So that's why kids always prone for the dental infections because they eat a lot of sweet.
Yes.
Because of a sweet people, they eat a lot of sweet. So they are more prone for the dental infection. So a kid
Okay.
will have a lot of decaying of teeth. So
Mhm.
it is always better to do the treatment for the deciduous teeth or a kid's teeth.
Yeah.
So that that gives a permanent pathway for the permanent teeth to erupt.
Okay. Okay. So it is okay to do the filling and all
Yes,
of that also for
100%.
the. Okay.
100%. Yeah.
Okay.
And
All
we have
right.
a
Yeah.
specialization in kids also. We call it as a pedodontist. Now,
Okay.
dentistry has spread to that level, like a specialty level. Previously, it used
Mhm.
to be in a normal this thing. No one used to prefer a specialization in a dentistry. Now,
Okay.
people are preferring a specialized dentist.
Yes. Yes. That's yeah. I mean, specialist in any stream is always
Yeah,
accepted, expected, and has their own value.
true, ma'am. True.
Right. Yes, Neeraja Garu, she's saying he's the one at the door to help all and gives good treatment. Even in COVID pandemic, instructed us in healthy way in simple words. He is like a book of knowledge అని చెప్తున్నారు.
Oh, thank you. Thank you so much, Nirja garu.
Good morning, Bhavna ji and Dr. Chandra ji అంటున్నారు. One of the Facebook users. It can be family too అంటున్నారు for the dental checkup, I guess,
Yeah.
like once in 6 months. Gaureshwar Rao Garu. Our Dr. Garu is very understanding, down to earth personality and very cooperative person with good experience. Patients are always satisfied with his treatment అని చెప్తున్నారు.
Very happy to hear all these things.
Yeah. Separately for every kid will be hectic for you, sir. Let us plan for all the kids of Agastya and Valmika together. Just a 30-minute session అంటున్నారు.
Super.
Srinivas Garu, why only to the kids of Agastya Valmika, kids of all Vysians? Globally, we can have a session. Like, we did celebrate Children's Day, right? That was a good time for you, like maybe. But definitely, we can just have an extended version of it where, or we can keep it open for, like, we have our dental doctors from other states also. So, all of you together can plan a session wherein all of you can become friends of our kids. And I mean, at least for them, like for kids, right, whatever teacher says is true,
Yes.
correct. Whatever
Yes.
parents say, they won't listen. Like, my teacher said this, so even like this is something like that. My doctor uncle said this, yeah, then they will follow, they will understand. So it
True.
is like that.
Yeah.
So good thought, Srinivas Garu. Let us please plan with our Dr. Garu soon and let us know. We can host it for our all the Vivasians, maybe
Yeah.
even open for outsiders. We could keep to some extent, like first come first serve basis.
We'll plan an event, ma'am. Yeah, it's a good
Yes.
thought. We'll plan an
Yeah,
event like a dental
definitely.
tour for the
Yeah.
kids.
ఓకే. ఫణి కుమార్ గారు అంటున్నారు, డాక్టర్ గారు విల్ డూ పెయిన్‌లెస్ ట్రీట్మెంట్ అండ్ వెరీ కేర్‌ఫుల్లీ అని చెప్తున్నారు. ఓకే. రవిశంకర్, డాక్టర్ గారు, హౌ ఫ్రీక్వెంట్‌లీ షుడ్ వి గో ఫర్ ఎ డెంటల్ చెకప్ అంటున్నారు. వి స్పోక్
Yeah,
అబౌట్ ఇట్. ఐ థింక్ హి జాయిన్డ్ లేట్.
yeah. Then
ఆహ్,
every 6 months. Yeah,
ఎవ్రీ 6 మంత్స్. Okay, so it's good, like once in 6 months, see your doctor. Just ensure that everything is in place, or if some treatment needs to be done, it's done well in advance, not till it goes to the last stage and then do the treatment. And then sometimes it comes to a state where you have to just remove the teeth and nothing can be done. So to avoid those, it's good to get treated once in, I mean, get checked up once in 6 months. Treatment will be decided based on the checkup results. All right. Okay, Gopal Garu is online. He's saying, "Good morning, Bhavana ji and Chandru ji. Always smiling. Simply call him Smile Doctor." Antunaru.
thank you, Gopal. Thank you.
Okay. Sure, ma'am, but ours can be physical, and for entire Vivash, it would become an online. Otherwise, we can plan state-wise, house-wise. Frankly speaking, it is need of the hour. And okay, if it's an offline event, I would definitely be happy. Please go ahead and let all the wiser people get benefited out of it. Definitely. Ramji Garu is there. Happy morning. Dr. Chandru Garu was just a call away during COVID pandemic and did his best to help all అని చెప్తున్నారు.
Okay.
He is also one of the soft spoken members in our Agastya family అంటున్నారు గోపాల్ గారు. I don't know who this is. They're saying doctor is a super dancer అని చెప్తున్నారు. Oh, so you have a lot of hidden talents also, Dr. Ji.
Yes, ma'am. Lord.
Nice. This doctor knows how to attract patient for pleasant treatment అని చెప్తున్నారు. భాస్కర్ తాడేపల్లి గారు.
Thank you so much, Sir Bhaskar Garu.
Okay, there's a question coming up. Is it recommended to use mouthwash at night and brushing at day, or two times normal brushing only to be done for better preventive measure? అని అడుగుతున్నారు.
Yeah, mouthwash should be used for not more than a month. We say 2 to 3 weeks. Not more than that, we have to use a mouthwash. Brushing will do. So mouthwash should be used, I mean, very little, like when you have some problems. But for a oral hygiene, not a frequent use of a mouthwash. You use it for 3 months, you can stop it. Again, you can use it for another 3 weeks. 3 weeks, sorry, not 3 months,
Not three
three
months,
weeks.
3 weeks.
Yeah,
అదే.
3 weeks. 3 weeks, you can use a mouthwash. Then you can hold it. Then after some point of time, again, you can start using a mouthwash. But as a daily routine, you can brush your teeth twice a day.
Okay.
That will be an
So
better
mouthwash is not recommended in the long term use.
long term. Yeah, long term because it
Any
has a lot of
specific
side
reason
effects.
for that? Side
Lot
effects.
of side effects. Yeah, it stains your teeth. Lot
Okay.
of burning
Means.
sensation. Altered taste sensation we call it as. But now lot
Mhm.
of mouthwashes has come into the market which prevents all these things. So I'm not going to
Okay.
discuss about which mouthwash is good, which one has less side effect.
Mhm.
But yeah, we always advise a
Better
mouthwash.
to avoid mouthwash as much possible. Go for brushing. Only if it is inevitable situations, you're
Yeah,
traveling or such cases, you can use mouthwash maybe.
yeah, like a
Yeah,
preventive
I
care you can use.
personally feel using mouthwash is little difficult if so for people who cannot take things like that.
Yeah,
Yeah,
understand.
so Okay. So, Prabhakar Rao garu unnaru.
Okay.
Doctor garu, nice to see you in this live chat. Is it necessary to brush teeth twice a day? Please explain what are the problems if we don't brush twice a day. అని అడుగుతున్నారు.
Yeah, basically, see, night time, why we advise a patient to brush his or her teeth is when we sleep, there won't be any motion of salivary motion in the oral cavity. Lot of sedentary state it is. Because see, when we speak, lot of saliva comes because it is a natural protector for the body. The saliva is considered as something. So nighttime it will be in a very silent mode. So we don't have much salivation in the during a sleeping mode. So that is where the bacterial proliferation occurs in the oral cavity. By the time you get up in the morning, you can see some bad breath. We call it as an halitosis. Okay.
Mhm.
So once when you start practicing this brushing or a mouthwash in the night times, it prevents these bacteria to proliferate on the teeth or the gums.
Okay.
So the next day will be a fresh day for you without much of
Okay.
an halitosis or a bad breath.
Yeah, that's good. Actually, the same question I had asked her, Kalyani Garu. She's a doctor from, as I said, from Hyderabad.
Okay.
So in her session, I know it's a very basic, simple thing, but yeah, is it just that it's good to know the scientific reason so that
Yes.
you can better practice it.
Yeah, the
Yeah.
activity of bacteria is more. See, if you have an oral cavity activity, the bacterial doesn't stick to your gums or doesn't stick to your mouth or a teeth.
Mhm.
But when your activity is not there, see, when you see, you salivate. When you think, you salivate. So there are
Yes.
many times when you salivate, but in
Yeah.
nighttime we don't
When you're
salivate, and
sleeping. Yes.
yeah,
Yeah.
yeah. So that's the main scientific why we say that nighttime you have to brush your teeth.
Okay, okay. That's I hope Prabhakar Rao garu that answers your question. Um, okay, Srinivas Rao garu, hi, good morning, Bhavna antunaru. Very good morning, Andy. All right. So, yeah, I think it was really nice to know about why we have to maintain the oral hygiene and more tips and tricks for our. So, what do you call as a golden rules to maintain teeth? Anything specific that you would like to share, Chandrasekhar garu?
I advise everyone, whether you have a problem or no problem, go to a dentist in respected areas
Yeah.
and don't get scared. Uh, Most of the dentists does a wonderful job. So prefer a dentist in your local place. First thing I say that go for a dental visits, friendly dental visits. I call it as a, not for the treatment. Establish your relationship with the dentist. Keep a family dentist with you, frankly. So that is one thing. Then brush twice, more carbs, more carbohydrates, or fiber food. We say that more of a fiber food you advise. We advise more of a fibrous food, less of sticky food. Okay. And that's why we don't say that don't eat burgers or pizzas and all that stuff. We say that use of more of the fibrous stuff. And yeah, I mean, that one will do.
Yeah. Okay.
And don't take your Google search and self treatment for any kind of an issues. So have a,
Yeah, because case to case it depends. Might be one solution for someone, might not be the right solution for you. It might
yeah,
aggravate the
it won't
situation
work
also.
out every time. So because
Yeah.
lot of knowledge is there in the Google, I know that. But
Mm.
always give a call before going for a self treatment for any dental issues. Then decide for
Okay.
the. I advise that.
Okay. Yes, definitely. Gopal garu అంటున్నారు డాక్టర్ చంద్రుజీ is not only a dentist but a good speaker too, multi talented అని చెప్తున్నారు.
Thank you so much, Gopal.
Okay, might not be a good question for you, but Srinivas Rao garu is asking tips to avoid dentist doctor అంటున్నారు.
No, I don't accept that. Sir, some are inevitable. Ma'am says, no, that you have to come to a dentist. See, always we see in medical profession, we say that prevention is better than cure. That's
Yes.
why I was saying that go for a
It's
dental
not for
visit.
treatment, it's for checkup actually.
Yeah, check
Routine,
up.
regular checkup.
Yeah,
Yeah.
that's it. See,
Okay,
when we sit in the
Prabhakar
house,
Rao garu. Hmm.
we don't get
Yes,
a dental awareness. But when you go to a dentist, he creates that awareness. So
correct.
go for that.
Correct. Yes. Okay, he's saying thank you so much, Dr. Garu, for that answering that question well. There are a number of pastes in the market. What type of paste we should use in Tunaru? So we spoke about it already. I think you should use the simple, normal toothpaste. He's
Less
telling
abrasive
avoid
paste. Less
less.
abrasives. Yeah. Abrasives. Abrasive paste. Yeah.
Okay, so it's better to avoid the gel kind
Gel
of
forms.
toothpaste. Is what
Yeah.
he's saying. Okay, I hope that answers. And Ravi Shankar Garantunaru, he's saying, Dr. Garu, will cavity spread from one teeth to another teeth if it is left unattended, or will it affect gums and nerves if I attended? Ani adugutunnaru.
No, it spreads to other teeth. Dental
Oh, is
caries
it?
always spreads. Yeah, spreads to other teeth. So that's why it
Okay.
has to be. It requires an attention. Dental caries requires an attention. So it has to
Hmm.
be treated at an early stage, and
Hmm. Hmm. Hmm.
subsequently it affects the gums and nerves also.
Okay. Okay. We cannot avoid you, sir, a magic man antunaru. That was on a lighter note, like the previous comment. Okay. All right. So really nice to hear from you, Dr. G. So, if I have to ask you, what is the USP of Lakshmi Dental
Dental
Clinic,
caries.
and why Mana Chandrasekhar garu unte? In your own words, what would you like to say?
Okay, after seeing my friends who has given a testimonial saying that painless treatment, all that. See, one thing, it is how you implement your treatment plan, treatment techniques matters your success in the dentistry. What I feel, if you upgrade yourself in a dental treatment technology, I think you will be an up to the mark. See, for example, one basic thing, I use basically cartridges for giving an injection. It's not very expensive, not very low, but it is more than the disposable syringe. It is
Okay.
expensive more than the disposable syringe. So little bit
Mm-hmm.
how I am different, I'm telling here. One thing is that painless because we use very thin needles for giving in blocks, so that helps for the
Okay.
patient. It's a painless. And for some procedures I use lasers, so we call it as a bloodless procedures. So laser cut gives a more advantages compared to the blade cut. Okay, that's one more thing. And we have an all research material. So whenever I'm buying one material, I find it out what is in research and what is a study for that. So it's like 10 years, what is a study of that material, what are implications of that material, whether it is advantageous for the patient. It is not like whatever the material in the market I go and buy it.
Mm-hmm.
So every material I use in my clinic will have some research potential saying that yes, there is a research study on this material done for a 10 years of this in this company, and the result is this. So in that way, I'm more confident that the materials I use is will be more what I say acceptable for all the patients.
Okay.
Biocompatible, we say it as a biocompatible. Doesn't cause any harm to the patient. Doesn't harm to the. I mean, no reaction for the patient.
Okay. Okay.
And most of the treatments are the single visits. I prefer in a single visits. First visit
Okay.
will be in a friendly visit. I don't treat immediately. If
Okay.
they convince me also, I don't convince the patient. They say that we'll have some discussion initial. So
Yeah.
first visit will be a friendly visit and second visit will
Mhm.
be a treatment visit. So
Okay.
in that way, my USP I can put forward to you, ma'am.
Okay, wonderful. That's really nice to know, Chandrasekhar Garu. So, Ravi Shankar Garu, I think your question is answered. The cavity may spread from teeth to teeth, and it might impact in the longer run on nerves and more also, right?
Yes.
Pradeep Kumar Garu is having another question. Like, good morning, sir. Pastes have indicative of red, blue, and green labels. What do they represent? అని అడుగుతున్నారు.
Um, I don't have much idea on that, but I have seen in a lot of WhatsApp groups and that one saying that a vegetarian paste and non-vegetarian paste, based on the chemical component, they have given the designation for the paste. But I don't have much idea on that labeling of paste.
Okay.
So
Yeah, so I think something that we need to know more about, but
yeah,
I think further we might come up with the answer for these questions
yeah,
as well.
yeah.
Yeah. సో శ్రీనివాస్ అంటున్నారు, గ్రేట్ వర్క్ సార్, ఆల్ ది వెరీ బెస్ట్ టు డాక్టర్ కప్పల్ అని చెప్తున్నారు.
Thank you so much, sir.
ఓకే, రవిశంకర్ గారు, థ్యాంక్స్ ఫర్ దిస్ ఇన్సైట్ఫుల్ సెషన్ విత్ ఎ రినౌన్ డాక్టర్ అని చెప్తున్నారు.
Uh, thank you, Ravi. Thank you so much.
Thank you so much, Andy. It's our pleasure to bring in good people, our members, to all of you, and for entering good knowledge. And definitely, when there is a need, you could definitely contact our people, and I'm sure they would help you with the best of products and services in whichever category of business they're doing. It's just that you need to just reach out to them. So today in the 90th episode of Business Bytes with Bhavana, we are talking to Dr. L. Chandra Sekhar from Vishakhapatnam, Vizag, who runs Healthy Smiles Clinic in Vishakhapatnam. The doctor is reachable at 9848382244 for any kind of questions or their services. You could definitely reach out to them. And if you're talking him to the first time, do not forget to mention that you got to know through Business Bytes with Bhavana, so that he will be able to connect and accept you better. Right?
Yeah.
Yes.
One thing finally, I want to close it.
Yes.
For the successful person, you require two things. One is
Yes.
silence, another one is smile.
Yeah. Which you have mastered. Yes. Yeah. Yes, sir. Definitely. Uh, we have still comments coming up. Dr. Garu, thank you so much for your valuable advices, Antunaru Prabhakar Rao Garu. Wonderful, sir. Ramji Garu is saying wonderful session, Ani. Thank you so much, Ramji Garu. All right. So definitely, it's my pleasure to host you, sir. And thank you for being part of this show. Anything more you would like to say before we close to our
First,
audience?
I have to thank you, ma'am, for getting such a beautiful initiative to, I mean, it's not like an interviewing a person, you're creating an awareness in the society regarding their profession. That's really heart touching, this thing. And first, hats off to your commitment, Bhavana garu. I mean,
Thank you, sir.
so
It's
great of
all
you
the
being a
energy that I
global
get from all of you.
yeah, being a global president, you're reachable to everyone to hold the community. That's really great. I never saw such people. So you're the one, you have a special, you're one of a special person for everyone.
Thank you. Thank you so much, sir. Thanks for that. And would you like to talk a little bit about your journey with WeVysya? How has it been? And
um, yeah, I mean, it was really, I mean, like, through Suvarna and Gopal,
uh-huh.
Adyabali Gopal, I came to know about the Vivaisha when they say that,
Okay.
like, so and so. I always doesn't see in a business format. Vivaisha, I don't see it in a business format. I always makes my present to create an awareness. What is the dentistry? What is an importance of an teeth or oral hygiene? See,
Hmm.
when you establish everything, everyone will come to you. So the main motto to be in a Vivaisha is that my motto is to create an awareness between the members, which I'm not
Okay.
able to do it in my clinic.
Okay.
I have a
Okay.
restriction. I have a restriction in my
So
clinic
mainly
because
to get connected to people, reach out to them, and then educate people and lot more like that. Hmm.
so in that Vivaisha, I have seen many of our members who are interested to show the at least to know the what is a dental treatment. In that way, I'm very happy to be with the Agastya family. Quite good
Wonderful.
support. Any head table, I joined during Ramjigar head table last year
Yes.
during COVID time. So
Okay.
most of the meetings are online only. I never
Yes.
used to have
I
any
know.
eye to eye contact.
To be honest, even I had a lot of plans, but then even my tenure is ending being everything online. So, yeah, I mean, anytime we can contribute to the organization. What about the roles? It's just the
Yeah.
thing. That's it.
Yeah,
Yeah,
being Srinivas Garu, one of the key role, he always supports us.
yeah.
I mean, he always says like, if you have any problem, kindly let us know. I have some technical glitches initially, professional problems initially. He said like, Doc, you let me know. I have a solution for that. So in that way, Srinivas Garu always available with us and present.
Yes.
Head table Satish and
Naveen and
Srikant and
Shrikant
Naveen and all
Garu.
that. They're doing it wonderful. They're getting that seriousness in the
Yes,
association,
organization.
the
Yeah,
organization. It's
yeah.
good to see the growth in the Agastya family. So now we are a family. I can say that.
Yes, absolutely. And now, like, with these sessions and a lot of other initiatives that we have done this year, I think we have got to interact with other state members also, and the bonding is increasing. And I'm very happy looking at all of these progress that is being happening. And it is a learning journey to all of us also, right? Like,
Yes, ma'am.
when it goes in the right direction, we're happy to. Thank you so much, doctor. So, Prabhakar Rao Garu, thank you, Bhavna Madam Garu Antunaru. Welcome, Andy. All right, so quickly we will see some of the creatives. Lakshmi Multi-Speciality Dental Clinic and Implant Center. So they have two branches in Vishakhapatnam, and definitely you could reach out to any of that. One doctor handles and one his wife handles, and both of them are doing great. And as they said, they try to avoid multiple visits and try to close the treatment in single visit to the best of their possibility. All right. So a couple of creatives. His wife name is Swapna, right? So dental implants, correction of bite, children dentistry, cosmetic dentistry, root canal treatment. So all of these are their specialties that they would. I mean, a lot of people could easily take treatment with, and I'm sure our doc will be interested in all the challenging cases also, if something different than these as well, right? So straighten teeth without discomfort. I think this is something new, right? Previously, they were going for the clips and all of that. Now we've got this transparent thing which you
Yes, ma'am.
could wear, and yeah,
We call it as an Invisalign.
Invisalign. Okay. Okay. So anybody you want to, you feel like you need to perfect your smile more, then I think you have better solutions as on today, and without much hassle, without much. You might feel okay, 9 months, 1 year treatment. I should wear a clip and all of that. You could overcome that now easily. I feel so, right? Yes, keep your toothbrush and holder clean. Yeah, this is another important thing. I also was, wanted to mention this because sometimes these are kept in open, right? If you're not maintaining them and something dusty or insects move on it and things like that might also impact the teeth, right? Because entry point, as doctor was saying, for everything is mouth, right? So it's really important. Would you like to add anything, doctor, on this?
Nothing else, ma'am. We have covered everything. You change your brush every 2 months. We say that.
2 months, huh?
Make
Okay.
every 2 months, and make sure that your toothbrush has an caps for that.
Correct. Yeah.
And nowadays, the person who are affected with the COVID, you change once you come out from the COVID, you discard your
Okay.
toothbrush also,
Okay. Okay.
because that is one source of infection for the viral spread.
Okay. Okay. That's a
Toothbrush.
good tip. Yeah.
Yeah. Always
All
use a
right.
medium and a soft toothbrushes. Don't go for
Hmm.
the hard toothbrushes.
Okay. Okay. Uh, okay. Kids dream dental care. Why chooses? Yeah, so as he said, his qualification also talks about like he's been upgrading to the new techniques that is being figured out, Ani. And also, like, they're also upgrading their tools all the time. So definitely, I think you could consider Lakshmi Dental Care for all your dental needs, for a regular checkup and treatment as well. If you're not from Vishakhapatnam, then don't worry, just have a word and understand more. And a doctor is reachable at 9848382244. Right? Um, so yeah, anytime, any tips like quick tooth pain or anything, you could reach out to a doctor, no problem. So they provide all these services: the cosmetic dentistry, pediatric dentistry, dental implants, Invisalign, that is the transparent for
Yeah.
teeth straightening, alignment of the teeth, right? Or they call it as orthodontics also, RCT. What is RCT, sir?
Root canal
Root
treatment.
canal, root canal treatment, yeah, or smile fast, crowns and bridges, etc. So a lot more are there. Any kind of help needed on keeping up the dental thing, you could definitely reach out to a doctor. Right, doctor sir, thank you so much for joining in, and it was really nice talking to you, and a lot of good questions that got answered, and your vision of creating awareness. I think I could also help you regarding that. So thank you so much. I wish all the best to you and the Lakshmi Dental Clinic to reach more and more heights and also have a chain of clinics as you dream and wish for.
Thank you so much, ma'am. That's really honor for me.
Yeah. Thank you, sir. Have a great day.
Thank you, and wish you good luck, ma'am. Thank you.
Thank you. Thank you so much, sir. All right. So today in the 90th episode of Business Bites with Bhavana, we just spoke to Dr. Chandra Sekhar.L from Vishakhapatnam, Vizag. So it was really nice to know the some tips and tricks to keep our oral hygiene and ensure we are not. Yeah, it's good to visit a dentist once in 6 months just for a checkup, but don't but it's good not to have a treatment every 6 months also. That defines how well we are taking care of our teeth. And definitely it's always good to have a beautiful smile because it costs nothing. It's just that smile that will fetch you more and more followers, more and more well wishers, more and more friends, right? So keep smiling always. And if you're an Arya Vaishya owning a business, still not part of our WeVysya family, I think now is the time. We have a presence in Tamil Nadu, Karnataka, Andhra Pradesh, and Telangana. So if you are from any of these places, then do not miss this opportunity to be part of this wonderful family, right? So while we talk about it, as usual, before we end the session today, thought for the day or the quote for the day, right? So we all deck up when we go out, or we all dress up, right? So you're never fully dressed without a smile. So do not forget how much ever you're dressed, wear a smile and then present yourself, move out of the home, or at home also you're always well dressed with a smile. So keep smiling always and have a great day today. I'll see you all again on Monday with another member, another business that we're going to talk about. Till then, take care and have a great day. Have a great weekend, utilize it in a right way, and enjoy with your family. Take care, and signing off, yours, Bhavna.
Thank you, ma'am. Thank you so much.